Okay, so I'd like to call us back into open session. Amy, can you call the roll for open session? Present.
Jennifer Locke.
Present. Okay, we are now in open session. The last item on our agenda is the appointment of our administrator. First off, there are many things I could say. I'll save it for the fundraiser. Wink, wink.
Okay.
But thank you, Julie, for over 30 years of service to public health, getting us through a pandemic, growing
It has been my honor.
to
And it's been a fabulous.
hundreds of staff members. Yes.
It has been fabulous. I mean, I'm not even gonna lie. I really enjoyed it most all of the time. Not all of it, of course, but seriously. Even when we had the rough period, I was still liking it. So it has really been an honor. So. Despite what the News Gazette first published that you were being forced out.
Well, you know what, I wanted to say, I know why they do that, because if you read the legal language, we're all used to it, but if you read that legal language, and then the next thing is appointing a new administrator,
Yes,
people
so-
are like,
Yeah. So I had to change the headline that Julie is retiring. I know she looks young, but she is choosing to retire.
but she's actually old.
At this time. But I really want to, it has been an absolute pleasure to mentor with you. I've learned so much about public health, learned so much about administration. I brought that into the township. I appreciate that you,
actually.
I appreciate your humor and grace. It has taught me how to have humor and grace in difficult times. And I love that it's the first board I've sat on where it really, the ship has just always been tight and sailed really well and hasn't needed a lot of course correction or intervention at all. And been open to our ideas. You know.
And that's leadership team.
Yes.
And that's gonna keep going there.
Yeah.
I'll keep going.
Yeah. But I just want to say thank you very
Yeah.
much for your service.
They're fabulous.
And I look forward to whatever way that you will allow us to celebrate you. I texted Julie.
A fundraiser for something.
We're negotiating
Yeah.
what that will look like, but I'm really looking forward to it.
She told us what we could have cake after she was gone.
I said it's not like I want to begrudge anyone cake. I'll send them cake if they want cake. I'm just, I'm just awkward. It's not pretty.
Would you like a Viking funeral?
That'd be pretty. That would be kind of awesome.
Yeah. I thought that you dressing up in the regalia on the unicorn pony would be probably be a good send off.
Well, I
Just
just
like we had
prance
for
right
Pride.
out of here. Prance right out. I might do that. February 2nd, I'll be taking some PTO, but February 2nd, I will be coming in the unicorn costume
The
and
unicorn costume and prance
prancing
out
down
on
Neal
the
Street.
pony.
Maybe I'll prance west, so I'm prancing in the sunset.
February 2nd.
I'll still be out there. You'll still see me all over the place because the advocacy and stuff I do, not gonna stop. I will just be more off the chain, I guess.
I thought you were going to say chill.
Less
restrained.
Probably less chill. They'll be unrestrained by a paycheck, let's put it that. No, and thank you all. And I said this to the various places that have interviewed me too, is that I have worked for a lot of board members, and only 2 attorneys, thankfully. But I've worked for a lot of boards, and the boards have always been good. Not the county board, but it had its problems. Back in the day, the county board of health was a problem. It hasn't been for years. But that's really something. I mean, because the township supervisors always, I don't have to explain things to them. You don't get into that position unless you understand kind of what we're doing. But the county board chair can be a wild card, and it has been a wild card in the past, but yet, even when we had people that we shouldn't have been able to work with, or we were told we wouldn't be able to work with, we still could. So it was just a matter of showing them what we do and how we do it, and that was it. So I appreciate all of you too, especially you for getting me on there. And I thank Carol Elliott, and I thank Linda Abernathy.
Wonderful. So you both.
because you know that it was a weird time, and I was not interested in the position, as Pat can tell you. But we were scared of what was coming next. So I was at least a known commodity. And that's always been my saving grace. I always told them they knew what they were getting when they hired me, because I haven't changed a bit. So, but thank you.
Thank you. Many more things to come. And we are feel extremely fortunate that you selected us, and have been just really enjoying working with you since you came in June into this position. It was an open hire for us to find a replacement as part of a 3-year strategic plan. We've been very planful about the transition. And when I first saw your resume, I was like, why is he coming to Champaign County? It's really important for us to have an MD in this position, somebody with a research background, somebody who is, has been in epidemiology, has been a director in public health, who's teaching. I mean, you're like the jack of all trades in terms of the experience that you bring. And public health has been, as you know, our public health is a leader in the state. And so whoever is going to be the next administrator has to be able to lead at that level, as Julie has brought up public health. And so I can't think of a better person to lead public health. We're really, really happy that you and your wife have chosen to relocate here and join us. We're a wacky crowd. I feel like we've done a good job of getting you to laugh. And I think that your experience, expertise is going to really help as we work to deepen our relationship with the hospitals and the U of I in particular. So I would like to make the motion that we approve Mamadou Tonkara as our next administrator with a salary that includes a 10% increase effective February 2nd, which would be your first day. That's my motion.
I second.
So a motion and a second, and I also just want to say that we understand that our performance evaluations happen on an annual basis. The board is involved in that process. We know you have an evaluation that's coming up in June, but we want to acknowledge that you'll have additional leadership responsibilities, and so wanted to do an immediate 10% increase to acknowledge that.
Okay, thank you.
Sure. I don't know if I have anything else you'd like to share?
It's been said. Everything I have to say has been said, but thank you for being here, and we look forward to your leadership.
Thank you.
Mm-hmm. And I don't know if you have anything you'd like to share about.
Yeah, so I just want to say that I'm very grateful, for the opportunity to come here. Last year, if you have asked me that, I'll be here moving with my family, I would say no, because it wasn't my plan. But when we had an interview and Julie was in there, and I just had that feeling of deja vu. Sometimes you see people, you just know that you have interacted with them before. So that, and so I trust my instincts. So when that happened, I asked her if I can come and see the place. The area. I've never been here before since that time. So I came and look at. So they took me on a tour. Like the way they treat people, specifically Julie, the way she really carry herself and treat me, really helped me decide if I wanna stay here. So I just want to let everyone know that I would do my best in everything I do. I try to do my best, and also try to carry Julie's legacy in being a leader in the community, being trustworthy, but also being honest in everything that's happening. So I've seen it over and over, and she said that she won't be a politician, but I can see a lot of traits of politicians. But really grateful to be here, and this is a learning curve for me too. So I would need everyone's help if there's any input, anything that I can do to make sure that the place get to new height. That's my goal, and I don't have any hidden agenda. Just so that everyone know. So that's what I wanted to share.
Wonderful, thank you so much. Yeah, we talked about how, when I first came on as a board member, I just sat with Julie, we had regular meetings, and we just, she brought me into public health, and I brought her into housing and other pieces, and so I really look forward to sitting down with you and having some of those times together. And I've been surveying actually conferences that show where the intersection of like public health and housing, and so I'd love to have us attend one of those together. Obviously, housing is not the only issue on the table, and all of the issues that public health, the maternal and child health, infectious disease, all of that is very important, and I'm committed to all of the pieces of it. And just so that one place is one of the areas that we've been moving into. As part of our strategic plan, as well as really looking at equity throughout the organization. And I feel like we've taken some really good steps before you got here, and we're taking additional steps now, and really looking forward to building a diverse leadership team that represents the communities that we serve, continues to support our immigrant population, in particular as a refuge. Government it can harm, but it can also be a very protective layer for immigrant communities beyond what 501c3s can offer. And so I think it's really important that we are able to tuck immigration services under a kind of robust and very well-known and reputable organization like public health. So. And I love the art and gardens, and I'm so glad to see what we've done to bring in the whole self of people. So. Yeah.
So I also wanted to say that I know that the news went on, and when I came in to my office, I saw a lot of emails from community members, sharing their thoughts and congratulating me. And other things on top of whatever Julie did and take care of me. So another thing that I've seen here is the sense of community. So people really care about this community and organizations. So I think that working also with partners to make sure that we still have that collaboration going is something that I'm deeply committed.
Wonderful. Thank you so much.
And do know that there are going to be a lot of places that are going to be very happy to have you replace me in their meetings. Trust me.
I don't know if that's true.
That's true.
There are times when I call Julie and I say, Julie, could you call the Coles County Sheriff's Department? Could you call them? Could you call? They're going to listen to you. They're not going to listen to me.
Well, they didn't have a choice but to listen to me on that. That was ridiculous.
Yes.
But when it got right down to it, as far as doing something, I need cameras. I need something.
Yeah.
I need something.
That's
Something.
quite amazing.
Yeah, I was.
So,
But he did understand, and I made it very clear to him that that could have led to that woman's death, and he's very lucky that it didn't, because the staff just happened to be driving by there, but she would have been dead
She would have been
in 3
dead.
hours.
she
She would have been dead.
Yeah, that was bad. So, yep, let's save lives together, shall we?
We will.
Okay. We have a motion and a second. Can I have a roll call?
Danielle Turner.
Yes?
Jennifer Locke.
Yes. Beautiful. Great, with that, we stand adjourned.
Thank you.
Yeah, thank you. Happy for you to do this.
Thank you.
Yeah. Julie, gonna make me cry tears.
Oh.